Josh has got diabetes, and we identified that Josh may benefit from flow through some information we had through the commissioners. Within his practice, there was a high incidence of admissions for diabetic patients. When we drilled down into this data, we found that for one patient, there had been 46 admissions in a year. And when we looked, it was actually just the one patient. So we got the practice to look at which patient this was. That was identified as Josh. And then we suggested to his practice nurse that flow might be something that Josh could benefit from. Flow is a very simple telehealth solution, and what it does, it makes use of patients' own mobile phone or their landline, and that's used as a way of communicating with clinicians. It's web-based, so that clinicians, wherever they've got access to the internet, they can access Flow, and they can put the patients onto whichever protocol is most clinically appropriate for the patient. Like for example with Josh uses a diabetes protocol. Most patients may only want readings from Flow perhaps 3 times a day, but for Josh he needs 5 times a day, so it was very easy to adapt the protocol.
I felt like I lost my independence. Really, I had to rely on a lot of other people. I mean, with the denial issues, I had to rely on my nan, my parents, people to basically kick me up the backside to do the test, and even still I was in denial. I'd rather just not do it at the time. That's what I just hated it. I let it take control. I think the worst thing really is emotionally seeing your parents upset about it all, and you realise you got to get yourself out of it. Still hard. Even today, I mean, I still struggle with it, I'm not going to lie, but it's just it's a lot more easier than what it was. I mean, there was sometimes almost 5 times a month maybe I'd be in hospital for flow. Now it's probably once or twice every 3 or 4 months, so it's gone down massively. It's a lot more easier to control. It is definitely a lot more easier having your on-hand medic. We went for a routine appointment, just like a chat, catch up, because me and my nurse get on quite well. She knows my story quite well, so we spoke about it, and she said there's a new idea coming along called the flow system. She goes, would you be willing to try it? And at the point I was just at my lowest, so I was ready to try anything. Out of everything I've had over the years, it turned out to be the most simplest, the most easiest, and the best option out of the lot. It's such an easy system to use because it's on, like I said, it's on hand. You don't have to rely on calling the surgery, you don't have to wait hours and ends for appointments. If you need well, it's the same with any medication. If you need that little prompt, that little nag to get you doing it, it's right there, giving you a message. I mean, like I said, I get 5 messages a day that prompt me to test my blood sugars. It gives me good advice, and it gives me good replies, and the reply times are absolutely fantastic. It's under a minute and I get a reply with knowing what to do if there is a problem. There is still hospital visits, but it's nowhere near as gargantuan as what it was before, and it just makes it so much easier to have that little on-hand nurse in your pocket to make sure to give you those constant little prompts. Well, setting it up, it was really quick and easy. Within the first day of even mentioning it, I had an appointment within a week to see Jane, who was the coordinator for the flow system, and within a few hours all my details were on the system, and by the end of the day I was getting my first messages to send me my messages and press stop, and obviously switching my life around. It took under a few hours to sort everything out. I recommend it be rolled out absolutely everywhere. Absolutely everywhere. If it can help me come out of the dumps, then it can help anyone. Because I was in a really bad place, not just with health, but obviously emotional wise, and I was very lucky I didn't have to go on antidepressants to control it. I managed to control it through determination, really, to get through it, and flow helped me do it. Yeah, getting rolled onto it, all you got to do is go into any surgery, see your GP or your practice nurse, inquire about flow, obviously find out all the information you want first before you make a decision, but it is so unbelievably easy to roll out, and it's such a quick and effective solution. It is no more waiting at the GP for hours, and it's like I say, you're on hand medical help.